Good morning, everybody, and welcome to our June HICP meeting. We're so excited you were able to join us here today, and we're excited to get started. We have a very full agenda. We're delighted to have a lot of wonderful speakers ahead. So grab that cup of coffee, that glass of water, whatever you want to sustain yourself through the next couple hours. And with that, we'll go ahead and get started. As you know, this meeting is being recorded, so just making that announcement up front. And in about a week's time, this meeting presentation, as well as the meeting materials, will be posted on our hicpla.org website. We do love seeing all of you, so please feel free to turn on your cameras. But we do ask, of course, that you mute your microphone unless you are speaking or asking a question, so we can minimize background noise. We love an interactive session. We love having you speak to our presenters and learn more about the topics that are of greatest interest to you. So please feel free and encouraged always to raise a hand or type a question or a comment into the chat. And finally, of course, we do offer simultaneous translation and interpretation into Spanish. So if select the globe at the bottom of your screen so you can fully participate in this discussion in the language of your choice. We encourage everyone to select the language of their choice so that you can get the conversation both ways. And with that, let's go ahead, review our agenda for the day. We'll have an update on the LA General Medical Center from our own Jorge Orozco. We also have a wonderful community health update with some phenomenal speakers. We have a presentation from a colleague at USC on a recent report and study on food access in East Side neighborhoods. We do have a presentation on housing for health and how that dovetails with how we serve and care for our reentry population. And then we'll conclude with a short presentation on some updates on the campus projects at LA General. As we get started, I'll go ahead and read aloud our guiding principles. All participants agree to basic principles prioritizing equity, community resilience, and health in all programs and projects. All participants agree to approach issues with an open mind, be willing to engage in dialogue, and commit to thinking boldly about solutions. Participants will state views and ask genuine questions. Participants will seek to avoid monologues and arguments, move to conversations where participants are curious and seek to understand various points of view. Participants will explain reasoning and intent, share how we reach our conclusions so that others can understand our divergent reasoning. Participants will attack the problem and not the person, organization, or institution. Participants will define key terms so that we can attain a shared understanding. Participants will share all relevant information. Participants will always arrive prepared for the meeting. During meetings, only one person speaks at a time. We will not engage in sidebar conversations. Participants will work to develop a comprehensive, common set of information with which to solve problems and make decisions. Participants will jointly design next steps. And with that, as always, I'm so excited to welcome our wonderful CEO at LA General, Mr. Jorge Orozco, who will walk us through some of the happenings on our campus. Jorge, welcome.
Thank you, Heather. I really am pleased to be here and to share updates about LA General. It's an exciting time. We had our reveal of our new name and our new brand, and we've had just an amazing reaction from community, from employees, from patients, and we're so pleased in terms of how this new name has been accepted, and so we're excited. Next slide. This week we held an AAPI celebration on our campus, and it was a wonderful event. The energy that was present, we had taiko drummers, we had a lion dance from a local high school perform, and we were just so pleased to recognize the amazing contributions of our AAPI community at LA General. June is Pride Month, so we are forming a big team to participate in the LA Pride Parade on June 11th at 11 a.m. So if you're interested in participating, and also if you want to share this QR code for anyone else in the community who wants to join this important event. Let's see. We're having a special movie celebration in coordination with our June Pride events. So we're screening Framing Agnes, and it will be on June 27th at 5:30. Admission is free for all attendees, and snacks and refreshments will be provided. So please join us for this movie screening. June, we also celebrate Juneteenth. So Thursday, June 15th, from 11 a.m. to 4 p.m. In our courtyard in the breezeway, we will have a big celebration for Juneteenth. So if you're interested in participating and hosting a booth, we're happy to have you join us there. So it's a great celebration. Every year we've had amazing participation and music and food, and so please join us. We also launched LA General Alert. This is an app that will provide real-time notifications via text or via an app that's downloaded on your phone for any sort of important events that are happening on our campus. And these are mostly sort of safety events. If we're having a code silver, which is someone with a weapon on our campus, we're going to be able to notify everyone on our campus immediately. So we have a campaign to get people to sign up to share their cell phone numbers so that they could receive these important updates in real time. We're also so pleased with the EDIA speaker series that we've had on our campus, and we've had 3 amazing speakers that have brought very important topics forth. So we have the links to those presentations available for 2 of the 3, and the 3rd one, Susan Burton, we will provide that link soon. So we wanted to share this with HICP to really share amazing resources and thought-provoking conversations that we're having on our campus. And with that, I'm happy to answer any questions from the group.
Thank you, Jorge. Wow, there's so much exciting stuff going on this month on the campus. Thank you so much for inviting the community to come out and join us at these wonderful events. Do we have any questions for Jorge? Nothing brewing. It sounds like you covered it all. I just wanted to make mention, the Framing Agnes is a kind of an interesting movie. It's a documentary / narrated film about transgender rights through some research that was done here in Los Angeles. So it's a really interesting movie. It's got an 80% on Rotten Tomatoes. So please come out and join us on June 27th for that pre-screening. Will that be in the inpatient tower, Jorge?
Good question.
Let's go back to that slide and check it out.
Flyer, let's see.
Yeah, there it'll be in our conference room, our beautiful conference room where we used to host our in-person HICP meetings. You can come join us for a movie screening. And then I wanted to also mention these wonderful speaker series. You know, the videos that are available are an opportunity. You could even bring them back to your organization. We plan to do that at the Wellness Center to have, you know, to screen the video together, then have a conversation within our team about these issues. So thank you again, Jorge, for sharing, making sure that these rich conversations are recorded so that they can be shared out with the community as a wonderful jumping off point for conversation about, you know, the legacy of healthcare in our country on the one hand, and then of course, you know, how we can, you know, practice better EDIA, equity, diversity, inclusion, and anti-racism in our own organizations. So with that, anything for Jorge? Okay, you covered
Thank
it all
you.
beautifully, Jorge. Thank you so much for joining us. Have a great rest of your day. Well, next up, I'm super excited to welcome two of our co-design members, Ari Gutierrez Arambola and Felix Tunador, who will be kicking off this next segment with some very special guest speakers. So, Ari, I see you unmiked. I'm gonna let you take it away.
Okay, so now I see Matt online. Yay, Felix. I don't see you, but I just wanted to highlight as part of this the HICP and this effort, I want to really express my thanks not only to you all, but to the county as whole. I got to see this morning the flag raising at the county of LA, on video. Supervisor Solis helped with that effort. And, as simple as that is, it is truly can be impactful. And I've understand also that they're working on a motion to raise flags in other county buildings throughout the region, which is amazing and terrific. It really shows a commitment to the community, and it shows that they're acknowledging our community as in terms of the fact that we're here and that we're not going away and that we do need support services. This morning, I also saw that in you know in the work that I've done, the LGBT community and many of people of color as well are disproportionately impacted by whatever issue there is: immigration, health, COVID, blah, other issues. To this morning, I saw sex trafficking, and I'm like, there you go, with our youth in peril. So, so I appreciate that you're here for this. We know it's Pride Month; it's about celebration, but it's also about um, working to make things better for our youth and our next generation. So I appreciate that. And so with that, we wanted to bring a health update from the community perspective. We've got Matt Inouye. He's now with the Trans-Latina Coalition, previously with Congressmember Jimmy Gomez. And so he's going to provide an impact on that. And Felix, are you here? So that you could provide some intro commentary as well.
Oops, Felix, you're muted.
Sorry, it's a tricky thing where I have both my phone and the computer going. Anyways, hi everybody. So in addition to Matt, we're also having Angel Martinez, who is the Director of Community Engagement at Community Programs within DHS, but he also has a lot of experience at public health, specifically around health equity. So he'll be here to talk to us about that.
So with that, Matt, you want to share with us what you've got?
Sure thing. Do you mind if I share my screen? Let's see. Okay, I do have access. Okay, great. Can everyone see my screen?
Yep, we can see it just fine, Matt. Your volume's a little tiny low. If you could bump up your... Perfect. Thank you so much.
Sure thing. I'll talk like this. Hope that's better. How's everyone doing? I hope everyone's doing well. Happy Pride. So my name is Matt Inouye. I'm the manager of policy and community engagement with the Trans-Latina Coalition here in LA County. Today I'll be talking a little bit about a few bills here in California. I'm the public policy person here at our organization, so I do a lot of advocacy. I help write bills with a coalition called the CTPA, which stands for the California TGI Policy Alliance. Some of our priorities revolve around holistic health, re-entry services for those exiting prisons, jails, and detention centers, And then our third one is data collection. So data collection pertains to health. The TGI community, which is the transgender, gender nonconforming, and intersex community, rarely gets counted here in California. And so in order to improve social services, health outcomes, we need to understand what it is that the state needs to do in order to improve their services. I'll talk a little bit about AB 1163. So AB 1163 is a data collection / public forms reform. Like I mentioned earlier, this is a big reform that we're trying to push here in California in order to have better health outcomes for the TGI community. The state must collect data to really improve services, to pinpoint specific issues. And this bill would essentially bring us to a 2026 deadline to have the state update their forms and start collecting information. Here's a little bit about some of the facts. It would be the largest expansion of public use forms in the state. It would include intersex to forms, and it would also target 9 departments, for example, the Civil Rights Department and the Department of Aging. And then we have AB 1487, which is our reentry fund. Our reentry fund would allocate approximately $5 million in funding, which doesn't seem like a lot, but in the TGI community, it goes a long way. And resource allocation. So this can be used for holistic services in regards to housing, career training, financial assistance, gender affirming care, legal assistance, and the big one really for the TGI community is gender affirming care, along with housing. Those are the really big two that this fund would help support the community with. So that you can read about the fiscal impact. It would really be a capacity building bill. This would help TGI-led organizations provide those services that I mentioned. And the goal is to really pass them through committees and get it passed into law. And then the last bill, so the TGI Wellness and Equity Fund. So for services, this is also a capacity building bill. Essentially what this bill, which was passed into law a few years ago, it allocated $13 million in budget for TGI. I think I heard for TGI-led organizations. As of right now, the funds should be released this month. So if you are a social services organization that works with TGI-led organizations, you might want to consider looking into this. And clinical organizations will be prioritized first. So yeah, those are the 3 main priorities that I'm working on here at Trans Latina Coalition. And if you are interested, here are a list of TGI or LGBTQ bills that you can look into. So if you want to screenshot that, take a look. AB 957 is a big one for our youth. So feel free to take a screenshot and open to take questions.
Thank you so much, Matt.
No problem.
So I think next up, we'll have some a presentation, some comments by Angel.
Hi, folks. Can you all hear me?
Yep, we can hear you fine.
Awesome.
Welcome.
Great. Thanks, folks. And if it's a little loud, I'm at a coffee shop. My Wi-Fi went out at home, so the next best place was here. So awesome. Well, hi, good morning, buenos dias, everybody. My name's Angel Martinez. I'm with the Department of Health Services, specifically with the Community Programs Division. Under community programs, just so you all know who we are, we house Housing for Health, Office of Diversion and Reentry, Mama's Neighborhood, Harm Reduction Division, My Health LA, which will be sunsetting at the end of the year, and Medical Legal Community Partnerships. So those are the 6 different programs that are housed under community programs. So it's an opportunity to also connect with me afterwards if you're curious or anything there intrigues you. But what I'll be focusing on today is some of the equity work that we did over the course of the pandemic. And the reason this becomes important is primarily because of the way that one, it was the urgency of it and the way in which county was able to move much more rapidly. And two, the ability to be able to work directly with our community-based organizations to be able to really get a firm understanding of how do we provide that direct engagement and really level out that playing field so that equity is centered, not just a lens that we put on, not just something that we ensure that we check off, but really centered in the work that we are doing, but also in the policy and the infrastructure that we build out in the work that we did for some of the COVID work that we want to continue and are continuing to do. So I'm going to share some slides with you. Give me a second.
Angel, you're muted. We can see everything, but we can't hear you.
Thank you. So I kept saying, can everybody see that? Awesome, perfect. To talk a little bit about how we centered some of the work around equity, it's really around the collaborations, the connections, and how we were really able to serve as county partners, right? And so as I move through it, please feel free to jump in the chat, share whatever you have. I'll leave the slides up a little bit so that you could read some of those the components on there, but I'll highlight the big major pieces and why these become really important for us thinking about how we continue to move through equity work now and into the future. So a lot of the program was really focused around really targeting morbidity and mortality for specific ethnic demographics and as well as focus demographics. This ran, the gamut of both ethnic and racial demographics, focus populations for folks who are undocumented, LGBTQ, low income, and then really thinking about how we do that targeted outreach and engagement work around high impacted neighborhoods. So working collaboratively both with the Department of Health Services, working with our data team, and really figuring out what are the ways in which we really think about doing that work. And I think that this becomes really important because we've continued to do that as we step back into doing and re-engaging in other fields of work, right? So if we were able to do it for COVID-19, that means we should be able and are continuing to do it in that way. And really thinking about that direct engagement as we talk again for those priority communities. So to share a little bit about the goals, this was really a partnership, right? Where it was constantly developing mechanisms to think about what are the ways in which we ensure that the CBOs have what they need in whatever capacity we could provide, both between us as the Department of Health Services and the Department of Public Health, because it was a joint effort. And part of a mandate from the board, right? And so really thinking about how we're looking at, the distribution of protective wear, how information is being shared, and that became really, really crucial. And I'll share a little bit in just a second about how we engage some of the communications in that media, because it becomes constantly important in all the work that we continue to do. And then really centering the role in which we had as county partners to really have the backing, because as many of you all know, and as you all are a part of many of our community organizations, I also come from the community organization world. I spent over a decade in the CBO world. And Adi, it's great to see you and glad to be here with the Inequality Alliance. But it's also been about really thinking about how do we meet those needs from our end. And the way that we did that and the way we said it, these are some of our partners that we had for the COVID Equity Fund. Again, it ranged across geographic region, focus demographic, and really thinking about how we were thinking about engagement, direct capacity building, and how we were ensuring that the organizations were well equipped. So a lot of the work really centered around, developing out and figuring out ways in which we combined on the ground work with in the air work, right? And in the air work means the media work, right? What were we sharing across media channels? What was being said on the ground, and how do we bridge and help do that not just within us as county partners, but as well as with our community organizations and in partnership with different media organizations. And in that process, building out that capacity, not just for us internally to continue to work with the CBOs, but also to be able to ensure that engagement was continuing to happen. I think one of the things that was really important was just kind of, taking a look at the project overall as we reflected back, and what are ways in which we're going to continue to see that and develop that out. For our project, this is kind of the supervisorial district spread of the outreach and engagement work. And then as well as, looking at both virtual and in-person. We're knowing that in-person is happening a lot more now. And that became really important for folks to be able to have those connections and develop those vibes with one another again, right? We know how important those one-on-one connections are, and even just being able to have community care or collective care. Some of the engagement work and flyers that folks shared, some organizations, and we have some quotes because we did do some qualitative work with them afterwards. But so many of the organizations started, engaging and developing video formats, which is something that they weren't able to do. The funding was for the most part, non-discretionary funding for organizations based on the amount of engagement. So it really allowed organizations that flexibility to do as they needed and to pivot and respond that way. And we want to make sure that there's, as we're thinking, as we're moving through the equity work and the funding that we now have with ARPA dollars, how we continue to do that. We'll share a little bit more as we move through it. And then again, as I mentioned, there was, kind of the three focus areas was really about the community events, because they really allowed us to center the work. Thinking about cultural and linguistic messaging, which is something that should and continues to take place as we continue even to partner with other partners, both at USC and UCLA, and on other projects and initiatives, really centering that cultural and linguistic messaging and finding those partners, both between the CBOs and as we're working with culture and ethnic media to really tie in those components. They make a world of a difference. And then really thinking about localized service delivery and how we continue to think about localized service delivery outside of just a COVID realm. And then I just wanted to uplift the work that was done around non-English language use. This is extremely important for our county, obviously, and you all know that. But one of the things I wanted to highlight was just Foothills Unity, right? The ability to have things in multiple languages, especially when organizations can only focus or provide specific information in or specific interpretation. But then being able to have access to things in multiple languages and making that constantly available. And that need for that information to be available, even if their staff may not be able to interpret right away, to still have and develop relationships with folks who are non-English speakers and have things at their fingertips, especially so that folks can continue to build out those relationships. And then kind of as an overall and at a glance, with all the organizations, at least for us, there was over 35,000 events that took place, really understanding the benefits to the CBOs with the flexible spending. And that comes back down to economic equity, right? Really centering the fact that like the work shouldn't just have specific parameters, it should really allow organizations to engage within their capacity. So whether they're a service organization or an advocacy organization, or a combination of both, not having that mix of those organizations at the table allows for the kind of cross-sector collaboration. And then most importantly, and I think one of the things that I wanted to uplift the most is as the county and in that response was really centering the equity for community-based organizations. We called on CBOs to really show up for communities, and they already do, right? Community-based organizations already do that. But being able to really uplift that work and to also say, as we continue to work with our community-based organizations, what are we going to do on our end to ensure that there's equitable access to the funding as funding continues to happen? How are we going to ensure that the work is within and and allows for the capacity to help all sorts of levels of organization? One thing that's not on here is one of the priorities for us was ensuring that we supported organizations that whose annual budget was under $1 million, and that became really important because we knew that smaller organizations were going to be harder hit. And one of the awesome pieces is being able to see how some of them have continued to develop out, right? And so, for example, African Public Health Coalition, shared that they've been able to hire and also sustain the hiring of more staff. And for some organizations that became really critical. And for others to be able to develop skills like engaging and working directly with cultural and ethnic media, right? Healthy Nail Salon Collaborative shared with us how important it was to have radio information for their specific demographics. And sometimes a lot of this doesn't get captured, right? And so one of the things we wanted to be sure that we did was to capture those nuances and to ensure that these lessons continue to take place, and to be lessons learned as we move through additional funding, whether it be JCOD funding, or as we're moving through ARPA dollars, and even as we continue to think about for us here at the Department of Health Services, what those collaborations mean. So thank you all for the time and for engaging. I'm happy to answer any questions and to share a little bit more about what we're doing now.
Thank you so much, Angel. Thank you also to Matt, reflecting back to Matt. I love the adopted logo for the month of Pride. Really beautiful there.
Yes,
so yeah, let's have a little bit of a conversation. Do we have some questions for our wonderful presenters this morning? Any questions, any comments?
Yeah, hi.
Teresa, thank you so much.
This is fantastic. I really appreciated the Matt's and Angel's presentations. There was so much that came out at every level of our communities and counties and states during the pandemic. And I'm sure you've heard this question over and over again from the CBOs, if not through yourselves, Matt and Angel. But I was really intrigued by the sustainability of all of this, and I'm glad that you focused, you really reined in on the smaller CBOs with limited resources, because those are most often the ones that are most pressed and most rooted in the community too. So I was wondering, could you expand just a tiny bit about how it is that the community is collaborating, or the county is collaborating with community to sustain this over the longer term? I saw philanthropy noted in one of the slides, but I didn't hear a lot more. And I think I've seen where in other initiatives, health related and social services, the state has an influence and partners with philanthropy in general to help leverage a lot of that, and wondering if you all were touched by any of that. Anyway, I'll just leave it there.
I'll start. Absolutely. I think, the part of what I shared there in philanthropy was one of the things that we were able to do was also to be able to develop some sense of matching dollars with philanthropy. So we worked in collaboration with some of the philanthropic entities across the state, and are continuing to do that and replicating a similar model that was developed out of the pandemic, to be able to identify ways in which, one, we identify funding within the county, to identify funding that could be matched by philanthropy, and three, which I think was huge, some of the work that we did for the COVID-19 work also required that for some of the smaller organizations, we did capture some of the challenges and the barriers to just onboarding with a county, or to all the requirements. So we did develop a white paper, which I'm happy to share with you all, around the challenges that some of the smaller organizations face, primarily with insurance, primarily with meeting the specific lines of coverage or certifications that were needed, that because we had philanthropic dollars, we were able to reallocate those dollars there so that it wasn't a barrier for certain organizations to come on board. Which one of the things that we did do was ensure that in the process of the time that they spent with us, that we got them to a place where when they parted from us, right, and as the program sunsetted, or the project sunsetted and the funds moved, that those organizations were equipped or ready to be able to receive that funding in the future, right? So that became really, really critical. I can't say enough like how many organizations now, at least on our end from the county, that we can see that are now qualified for specific funding requests or RFPs to be able to now apply because they meet a lot of those at times, unfortunately, rigorous requirements that we're hoping to continue to find ways to model out.
Right. That's great. I'm very glad to hear that insight. On that white paper and any other information you think it's helpful, for those philanthropic partners you already have, it's important for them to have that information. You know, as you mentioned earlier, data is powerful for policy and social change. So that's another one as well. Yes, you know, there is the Northern and Southern California philanthropic associations that are working. They're funding much of what you're doing as well. So it'd be good to leverage that to the extent possible. Excellent presentation. Thank you.
Yes, thank you so much. Do we have any final questions for Angel and Matt? Well, with that, we wish everyone, and especially our wonderful presenters, happy Pride Month. Thank you so much for joining us today. And we look forward to future presentations where you can update us on the needs of the community and kind of the response from community partners and the institutional organizations that serve them. So thank you so much for joining us today.
Thank you so much, folks. Happy Pride. Take care, folks.
Take care. So next up, we have a presentation by a colleague at USC, Dr. Kayla De La Haye is here to talk with us about a recent study, a research project in Eastside neighborhoods looking at food insecurity. So welcome, Dr. De La Haye. I'll let you take it away.
Thanks so much. Thanks for the invitation to join you all today and be part of this conversation. David, did you have anything you wanted to say before I jump in?
My apologies. I should have turned it over to David if you want to do the formal introduction.
Sure.
Thank you. Welcome, David. Welcome, Dulce.
No worries, Heather. And good morning, everyone. And thank you, Dr. De La Haye. Good morning, everyone. Thank you for allowing us to present this morning. My name is David Galavis. My formal title is Associate Vice President for Community and Local Government Partnerships with USC. And my team is responsible for directly engaging community members, both in South LA and in the critical communities of the East Side, which nurtured many of us here today. I also just want to briefly acknowledge Dulce Acosta, our Senior Principal Director, who really focuses on Boyle Heights, El Sereno, Lincoln Heights, and really engaging our neighbors here. I just want to say briefly before I introduce Dr. De La Haye is there's a lot of outreach and engagement that USC is involved in, including the USC Street Medicine Program, which is run by our Department of Family Medicine, which recently received $4 million from the city of LA and has become one of Mayor Bass's critical components to combating the unhoused crisis. We also are an integral part, thanks to Dulce, of a tri-county effort featuring LA, Orange, and San Diego counties to deal with incarceration and developing alternatives to incarceration with our USC School of Social Work. I'm glad to hear the previous presentation that focused on nonprofit issues. We run a nonprofit resilience program and a Bridges to Business program, which literally services about 250 organizations. So we'd love to continue to talk to you all to see how we can continue to engage. But one of the most impactful things that we do is we connect our incredible researchers like Dr. De La Haye to develop community-focused research. And one of the key issues that we've discovered is the issue of food insecurity in the East Side. And Dr. De La Haye is one of the key researchers at USC who focuses on health equity. And her current title, she's a professor, associate professor of population and public health. And again, for Dulce and I, the work that she does is really illuminating. And I just want to, before I turn it over, to want to thank her and her team for how she's been able to engage our community in her research. So Dr. De La Haye, please take it away.
Thank you. And the thanks also go back to David and Dulce and your team, because they've really helped connect us with key partners in the community that allowed us to do a lot of this work. So again, thanks for inviting us to share this. I'm going to give a really quick overview of the work that David mentioned. And then we're very happy to share links to our project website and a report that we have out in English, and the Spanish version is forthcoming in the next few weeks. And so we'd be happy to share that as well. But I'll do a fairly quick overview of some of these key findings today. Is that showing up okay?
Yep, we can see it just fine.
Great. And I think I'm not in presenter view, am I?
Yeah, if you go to view, you can do full screen.
Yeah, thanks. There we
Go
go.
down 2 more.
Okay.
Yeah, there you go. You got it.
Thanks so much. Okay. So I'll give an overview of work that our team has been doing over the last 3 years, both county-wide focused on food and nutrition security, but also a deep dive we did in collaboration with David and Dulce and their team, really looking at the issue of food access in the east side of Los Angeles. And I want to premise this with work our team started doing at the beginning of the pandemic, where we were the first to document a huge spike in food insecurity at the county level in the first few months of the COVID pandemic. So the LA County Department of Public Health tracks food insecurity among low-income households, and they've been doing that for a decade. We started tracking it quickly at the beginning of 2020 because there was no data coming in at the county level, and found that 42% of households that are low income in the county experienced food insecurity in that first year of the pandemic. Things got a lot better in 2021. Our data showed that we dropped back down to pre-pandemic levels, thanks in big part to a lot of the community efforts and assistance that were being rolled out to address this issue in 2021. And we've conducted 2 surveys in 2022 showing a really alarming uptick again in food insecurity this year. So 1 in 3 low-income households in this past year were food insecure. And what we're seeing is that from our survey data and interviews is this is really being driven by the end of pandemic era benefits, coupled with huge spikes in food prices and financial challenges that folks are facing this last year. So some alarming trends that we're working with right now. The other thing our team has been documenting is who has been impacted by this issue. And we see that the groups most impacted by food insecurity in LA County include women, households with children, immigrants, and we see really large disparities across race and ethnicity. So in 2022, when we surveyed all households in LA County to get estimates, we found that 1 in 4 households were food insecure, but that rates were 3 times higher among Latino and Black households compared to white households in the county. So there's huge disparities to address in thinking about how we're tackling this issue. Just to be clear, what I'm referring to and why we're so focused on food insecurity at the School of Medicine and as someone working in public health is that we're thinking of food insecurity as disruptions in food access and people's regular eating patterns because they lack money and resources. And critically, it causes poor nutrition and actually puts people at risk for diet-related diseases like diabetes, and has a whole sequelae of mental health and well-being issues for both adults and kids. And the goal we're really striving for is nutrition security. And the USDA recently put out a definition for this goal, and it's when all people at all times have physical, social, and economic access to sufficient, safe, and nutritious food that meets their dietary needs and food preferences so that they can have a healthy life. So that's really what we're working towards from the state of where we're at in LA County. So over the last 3 years, our team has been working in close collaboration with partners at the County of Los Angeles, particularly the county's Food Equity Roundtable, that is a partnership between philanthropy, county, and community partners who've just set a new strategic plan for the county around addressing food insecurity and the food system. And we've been working in close collaboration with community partners like the LA Food Policy Council and the LA Regional Food Bank, and as well as data partners like Yelp and Find Help to get critical insights and information about what's going on with food insecurity and food issues, and to partner with them in trying to tackle this issue. So we've been doing work like tracking food insecurity and who's at risk. We've been tracking what programs are working, like CalFresh, but also what is still needed. Our team is currently building a data dashboard with these partners that includes up-to-date and timely information about many different aspects of food insecurity in the local food system. And we've been working a lot to translate these insights so that they have an impact in our community. So we've been working with the County of Los Angeles and groups like the American Heart Association to get this data into policymakers' hands so that they can allocate resources and tailor their programs. And we do a lot of media and conversations with the community to try to help drive this conversation forward. And our team and the food equity team was able to present at the White House's meeting at the end of last year on this project and really showcase what's going on through these collaborations in LA County. So I'm gonna, well, and actually before I get to that next stage, I also wanna highlight that we have a really large team working on this across the university, as well as our partners that include people with expertise in public health and public policy and spatial science, great students from the USC community working on this issue. The Public Exchange is an office we work very closely with at USC and who have really fostered this whole team and these collaborations, and they build partnerships and help researchers like me build meaningful partnerships with public and private partners so that we can have an impact with our science. And Dulce and David and Melinda's team have also been facilitating these strong community relationships. And we've had some generous funding from the sources here. So I want to spend the rest of my time sharing a bit more detail about a specific deep dive we did in 2022, looking at food access and access to healthy food, especially in 4 East Side neighborhoods in Los Angeles. So our goal with this project was to really do a deep dive with community members and look at a granular level in these 4 East Side neighborhoods of Boyle Heights, City Terrace, El Sereno, and Lincoln Heights at healthy food access and grocery access specifically, to understand some of the challenges that were there currently and try to create a very tailored roadmap that could focus on an assets-based approach to strengthening healthy food access in these neighborhoods. And we're, at our starting point, thinking about this neighborhood as a vibrant neighborhood with rich history and a rich food culture, but also from a public health standpoint, neighborhoods that do have higher rates of food insecurity, that have populations with higher risk for some diet-related diseases, and where the USDA defines half of the census tracts in these neighborhoods as food deserts, meaning that folks living in these neighborhoods don't have good access to healthy food or affordable healthy food through grocery stores and supermarkets. But we felt like that was really not capturing the picture and the detail that we needed to really understand what some of the solutions were. And so the work that we undertook was to interview 31 residents who shop for groceries and food in these neighborhoods. And we actually identified and visited 269 food outlets in this neighborhood that sell groceries, and audited what they were selling and the cost of foods there. The last sort of angle that we took with this project was, instead of thinking about neighborhoods and census tracts and which ones were food deserts or not, we took a 15-minute cities approach where we looked at every single one of the 55,000 plus households in these 4 neighborhoods, mapped out where people can access within a 15-minute walk of their home, and calculated what food and grocery stores they have access to in that 15-minute walk. And this is sort of an ideal metric of wanting to ensure that people have access to essential services like affordable, healthy food within 15 minutes of their home. So I'm going to quickly share some of our key findings. The first big one was from our interviews with residents, and that we clearly heard across these interviews that residents want better access to healthy, high quality food that they can afford. The key themes that emerged from these interviews were that people felt like there were gaps in the quality of food in their neighborhoods. So having foods that were fresh, that weren't expiring, that were of high quality, but also cost and the variety could be a challenge in their neighborhood food stores. We heard a lot of folks talking about the extensive efforts they need to take to get food they need, so that they might go to multiple places to try to find what they're looking for to cook that week. Another key theme that emerged was wanting better options. There was a real strong feedback from many of the folks we talked to that they felt like the quality and options that are offered in many other neighborhoods in Los Angeles were not offered in their neighborhood. So people talked about wanting more plant-based food, or things that weren't so processed, or food that was of higher quality, and didn't feel like that was always the case in the stores in their neighborhood. Lastly, we heard folks talking about food assistance programs. So where there was food assistance programs available to them and available in the stores that they're shopping in, help them get the food that they needed and that they could afford. Our second key finding was around this idea of food deserts and really contrasting to that narrative. So despite the USDA telling us that these neighborhoods are largely food deserts, we visited 269 stores that sell groceries. But what we found really echoed what we heard from those interviews with residents, is that the variety and the quality of foods at these stores really varied, and the prices of food really was quite different across stores. So it's really not that these neighborhoods are food deserts. They have a very rich array of stores selling food and groceries, but healthy options were mainly found at the 36 of those stores that were supermarkets. So just 13% of all the stores that we looked at were supermarkets. And the bar graph on the right, the middle column shows the supermarket stores and the foods that were available at them. And what that picture is telling us is that the top of that bar chart is where the fresh fruits and fresh vegetables and other healthy options are. Those are always available at supermarkets, but on the far right column, for all of the other stores that aren't supermarkets, they very rarely had these healthy options. Compared to the bottom of that bar graph that tells you who had chips and ice cream and sugary drinks, pretty much every store was carrying those products. So the story this tells us is that there are a ton of stores selling groceries, but many of those stores don't have some of these healthy options available for people. And we saw higher prices at some of the independent stores. Another key finding is looking at this household lens. When we look at each of the 55,000 households in these neighborhoods, so on these maps here, each dot is one of those households. Red dots indicate where households don't have good access to food outlets. So on the far left, the red dots are the households that don't have access to a grocery store in a 15-minute walk, which is a real challenge for affordability and healthy food access. But that's not quite the whole story. The middle graph shows households that access to any type of store selling groceries. So there's very few red households there. Almost every household in this neighborhood has access to stores selling groceries. But again, they're those stores that have very limited healthy food options and options that are at a higher price. On the far right, we're looking at household access to stores that sell CalFresh. So again, very few red households. Lots of folks have access in a 15-minute walk to stores that accept CalFresh, but we have to keep in mind that very few of those are supermarkets and grocery and stores that have affordable, healthy food options. I think I'm going to skip over this one because I know I'm almost at time. I'm going to highlight this last finding that the other thing we looked into is sort of the array of programs that exist to support grocery access and healthy food access. We know that there's a ton of these programs operating in LA County, including in many of these neighborhoods that are doing great work to increase people's access to healthy food and make it more affordable and help neighborhood stores profitably sell healthy foods. But what became clear in our work is that there's real gaps that remain to strengthen these programs, expand them, and do more tailoring so that they have a real impact in meeting some of these gaps and needs that we documented in these East Side neighborhoods. So I won't go into too much detail about our recommendations, but we did end our report with really specific recommendations around supporting existing programs or expansion of community programs and taking this more nuanced household view around food access. And we're happy to share that link to the report to folks that are interested. So I want to end there to make sure we have enough time for questions and discussion.
Thank you so much, Dr. De La Haye. I see we have a hand raised from Maria Arellano. Maria, please ask your question.
Sí, hola, buenos días.
Hi, good morning, y'all. I think the nutrition point is very important. I'm sorry, especially because in our areas, I live in Boyle Heights area, and it's very sad to see that we have our local stores that are within our community where the products are in such bad conditions, they're expired and such high prices. I mean, it's almost 100% higher in price. For example, in vulnerable communities, for example, elderly, disabled communities, sometimes it's not even, they cannot even afford it to live day by day. And they don't have the opportunity to keep going or walking through different stores to find better options. With the very little that they receive is gone within the local stores. I mean, there's no control from the consumer's department to see if there's just to check that they're actually selling quality foods. Also, if we want a store that would have good quality food, we need to drive more than 25 miles because sadly in my community, I mean, I'm not against weed dispensaries, but we have more weed dispensaries in our community that are local or stores in comparison to where to stores where we could find good food and find something that would be of high nutrition. I think that we need more programs for us, more programs for communities of low income or in poverty levels, and also more supervision with these stores, the pricing of their products. Where is that control and that consumer management? I think that it's a huge crisis, especially during the pandemic and after the pandemic and at this point. We need the support, and I urge you for the support. Thank you.
Thank you, Maria. I must apologize. My Spanish is really terrible, and I've been getting a little bit of translation in the chat, but I'd love for a bit more help. Thank you.
As a reminder to all of our guests here today, the interpretation goes both ways. So please select the language of your choice in the interpretation icon in the bottom, and then you will receive the English language simultaneous translation. So just as a reminder to our presenters, I'm sorry that I didn't make that announcement again before we started this comment. So I don't know if someone else would like to kind of speak or I think a lot of what I heard Maria mentioned was the sense that a lot of the food is expired in local retailers, as well as very, very expensive. And so kind of how do we address those concerns? And I'm not sure if someone else would like to add some additional of the context for Maria's comments.
If I may, I can help add a little bit of in the translation there.
Thank you, Enrique.
She basically spoke to the lack of quality, and she's claiming for control. How much control are these stores really having? Which agencies are really controlling the quality and the amounts of food provided? And she's also saying that in her condition, she has to travel around 25 miles to actually get produce that is healthy and it's affordable. So her comments were primarily around the lack of control between governmental agencies, in that she has access to other services. She mentions with dispensaries that those are more accessible than the actual healthy food. So that's a little bit of means translated her question.
Thanks so much. And thank you, Maria, for the feedback. I think that completely resonates with what we heard from folks we talked to for the study and from the data, and a really anger from many of the residents about the quality of food that's available. Some of the things that we talk about in the recommendations that really come from our community partnership with the LA Food Policy Council and our partnership with the government is that there's going to need to be multiple folks trying to solve this problem around quality control. So one example is the LA Food Policy Council has a program where they have grants for small local run markets and food stores and work with them on trying to find better supply chains for affordable food that isn't at such a higher price. So they are doing really innovative things like bulk buying to try to get higher quality food into some of these smaller markets and help those markets get enrolled with SNAP or CalFresh so that it's more profitable for them. So yeah, I hear you, Maria, and we heard many of those same things and tried to carve out some ideas in the report about the many things that need to be in place to address those issues.
Thank you so much for the response. Do we have additional questions?
Hello.
Hello, welcome.
Hi, my name is Marta Jimenez. I'm a City Terrace constituent, and I would like to request constitutionally to Supervisor Hilda Solis to institute a farmers market in City Terrace. We only have one small mom and pop shop. The food is not enough, and we are surrounded by dispensaries of marijuana. So we are in dire need of having the farmers market rotate either from Juan Memorial Hospital or USC Medical Center, or the farmers market on 3rd Street. But we are in dire need. We have the worst quality of access to food, and that is not fair. What can you do to bring that about? I am collecting 6,000 signatures with the petition in order to get that done. How can you help us to bring safe food into our community?
Thanks for the comments. Yeah, I don't have any more to add. I think if there's any way we can support you in making these requests and calls, please let us know.
Thank you.
Yeah, thank you so much for the comment. I'm afraid Our SD1 colleagues, I don't believe they're here with us today because Supervisor Solis had another event, but we'd be delighted to learn more about your petition and find ways that HICP can provide support, as well as being able to elevate this concern back to the supervisor's team. Rose, I see you
Yes.
unmuted. Would you like to carry forward?
Yes.
Thank you so much.
Thank you.
We have 55,000 inhabitants in City Terrace, and we are a desert without food. Thank you.
Thank you so much, Marta, for that question. I do know, I think Anthony Cespedes is with us, and the question, Anthony, of whether a farmer's market could be instituted in City Terrace and what the process is to make that happen is something, we've jotted down. We will, inquire during the month and then come back to you with a response so thank you so much. I also want to remind everyone, as part of the development project here on the LA General Medical Center campus, they're in the community engagement work that was done. There is a strong push for a grocery store as part of the development. So, though it isn't a requirement, right, at this point, it is part of the recommendations of the community, all of you that participated in this process. It continues to be highlighted in discussions and, just reminding everyone that that is something that is in the community benefits request by the community for LA General.
And hi,
Rosa,
yeah,
can I
this is
say-
Anthony. This is Anthony, Supervisor Solis's office. Definitely heard you, and I will go back to our team here and find out what we can do. Thank you for letting us know.
Oh, thank you, Anthony. We're so glad you were able to join us today. I do see a comment in the chat as well, asking, will there be briefings with local state legislators regarding these findings?
So I can share that we have briefed some of the Board of Supervisors office on these findings, the LA Food Policy or the LA Food Equity Roundtable, who are overseen by the Board of Supervisors and who are leading this new strategic plan about addressing food inequity in LA County. And so we have briefed a number of staff from those offices. I don't know if David or did you want to add to that?
Yes, Dr. De La Haye, real quick, Teresa, thank you for the question. Yeah, we work with Dr. De La Haye's team and Public Exchange to make sure that all our local, state, and federal officials receive the report. And we offer briefings as well. And it becomes a part of our narrative as we talk to these offices about the different policy work the university is doing. This is definitely something that's highlighted for them as well. And we also follow up with some offices to talk about policy changes. And if we do that, we like to do that with other offices as well. So it's not just USC pushing something, it really is a collaborative approach with other offices.
Oops, Monica, would you like to ask your question?
So it's not a question, it's more of a comment. I know that as far as like the farmers markets, I know that in Highland Park and in Lincoln Heights, those are run by the business, by the business groups that they have there. So I don't know if City Terrace has something like that. If they wanted to start that, they can get it done with their bid if they had one. I'm just putting it out there if that's something that they wanted to do as well.
Thank you, Monica. Do we have additional, we see a couple comments in the chat, some additional conversation on this similar topic, some findings about consolidation in the food industry, particularly the proposed merger of Ralph's and the Ralph's parent company and the Vaughn's parent company. And then Juana Mena also comments that in her experience, it is very hard to eat healthy with the pricing in the neighborhoods of the East Side. So we thank you so much for coming forward today to bring this really critical issue and with such hyper-local kind of lens on it. But it is a big concern, and I know it's a concern when we talk about the consolidations. It's a concern at multiple levels. Food pricing is rising pretty dramatically, and it is, a big concern for a lot of families in our household, a lot of families in our communities. And I think we would definitely say that the experience we had in our work, community facing during COVID period, we agree wholeheartedly that that food insecurity was one of the most immediate impacts of the pandemic that we saw across our communities. So we really appreciate knowing about your research and your center that's kind of keeping its finger on the pulse of these issues, and look forward to, potentially future updates and conversations on this topic. I know it's of great concern and interest to our community. Does
Thanks
anyone
for
have
the
any final
invitation.
comments? Oh, I see Dulce has her hand raised.
Yes, I really just want to share and thank Dr. Kayla De La Haye and her team for being so intentional. There was so much that came at the onset of the pandemic. We established the first food distribution at the Weingart YMCA in Boyle Heights, where it was ground zero during the pandemic. Usually with the humanitarian efforts, they end, but the research and the data, I think that we've been able to acquire, and that Dr. De La Haye and her team continue with cultural humility to really be there alongside the community to really understand the needs and really provide this data that's really gonna support efforts moving on for funding and policy. I just really want to commend her. She made me proud just as a staff member of USC, seeing her and her team really being within the community and learning from the experts and the needs of the community. So thank you so much, Dr. De La Haye, for all the work of you and your team.
Thanks so much, Dulce. Thanks a lot for the opportunity to share today. And we have a lot of reports and briefings, and we would welcome any opportunity to support efforts addressing this issue moving forward. So please feel welcome to reach out to us if we can help your efforts in any way or the work that you're doing.
Thank you again, colleagues from USC, for the presentation. We love hearing from your really incredible researchers. Thank you, Dr. De La Haye. With that, we're running a little behind schedule, but we're going to pivot right into our next presentation. We're delighted to be welcoming Aubrey Martinez and Josh Legere. Maybe I got that right, maybe not, from our Housing to Health department. Just a reminder before we get started, please, everyone, select via the interpretation globe at the bottom of your screen the language of your preference so you can receive translation between English and Spanish in the language of your choice. With that, I'll let Aubrey and Josh take it away.
Well, thank you so much. Hi, everyone. I'm Aubrey Martinez, and I'll be beginning this presentation on Housing for Health and our Health Innovation Community Partnership. So if we could go to the next slide. Thanks so much. So just a little bit of our history here at Housing for Health. We were created in 2012 really as a prescription for housing for our DHS patients to reduce the inappropriate use of expensive healthcare resources and improve health outcomes. We've expanded greatly through investments by other county departments and Measure H to include many, many more patients. We are not just DHS patients at this time. That's a very small percentage. And really, we have housing and integrated service packages that are aimed at addressing the social determinants of health. If we could go to the next slide, please. Sorry, I don't have access to this one. So really, our HFH provides housing and services to people who are experiencing homelessness with complex health and behavioral health conditions, who are high utilizers of public services or other vulnerable populations. And we have three tenets of our Housing for Health services, which are housing first, harm reduction, and a whatever it takes mentality. It's a real flexible approach to service delivery that can be adaptable to a portfolio of different interventions, as well as really connecting clients to permanent housing without any preconditions or barriers to entry. And how we do that is partnering with community-based organizations who are really the experts in this. How we do that is we braid funding to create simplicity and sustainability on our partners' end, with master service agreements that enable quick scaling and flexibility within that, and high levels of collaboration, integrity, and frequent hands-on technical assistance. Then we could go to the next slide, please. Our overview of our programs are street-based engagement, which includes outreach and multidisciplinary services to individuals living on the street. Interim housing, which we have about 2,500 beds, which is short-term housing that offers a safe place for people to recuperate, stabilize, connect to services, and work on their permanent supportive housing goals. We have that as stabilization beds and recuperative care beds, but there's clinical oversight for all clients. And then we have our permanent supportive housing arm, which is housing assistance and individualized support services focused on housing retention and improving health outcomes. And we have 3 major buckets of that. Homeless prevention unit, which works with people that may be falling out of housing, permanent supportive housing, which is everyone, and enriched residential care for those who need more supports to be living independently. With that portfolio, we have over 22,000 clients. Outside of our housing and outreach, we also have benefits advocacy with CBES and clinical services throughout all of our portfolio, including mobile nursing. We have 4 mobile medical clinics, an array of services for all clients. And we can go to the next slide. And I'm going to send this over to Josh to go over all of our ARPA projects, which is part of this presentation.
Hello, great to be with everybody. So I'm going to give a quick overview of some of the ARPA projects we're working on. If you're unfamiliar, ARPA was signed into law in March 2021, provides funding to local and state governments to help build an equitable recovery from COVID-19 pandemic. So a portion of those dollars have been allocated to Housing for Health to assist us with some current projects we're working on. The funding has been well timed with a August 2021 board motion by Supervisors Solis and Kuehl that asked us to look at expanding the flexible housing spending pool, which is the pool of dollars we use for rental assistance and services for homeless individuals and families we serve. So the April 2021 board motion asked us to look at expanding the FHSP. The FHSP is really crucial for the homeless system in LA County because it is flexible, both in how we can use those dollars, but also in the eligibility of the clients we serve, the housing environments, the geography of where we're able to house people in the county. So it's a really crucial resource in the homeless system in LA County. And we're really grateful for the Board of Supervisors for the opportunity to expand by 1,000 slots. So we are in the process of expanding 1,000 slots across project-based and tenant-based housing. We've already matched 375 clients to resources thus far, and we're in the process of expanding 400 additional tenant-based slots right now. Okay. One of the ongoing challenges we have at Housing for Health is we have a variety of funding sources, both state, local, and federal. They all work on different timelines. So we have some time-limited rental assistance programs, and then we have that don't have service dollars, and on other occasions we're given funding that provides rental assistance but no services. So one of the roles we have in the homeless system in LA County is braiding different funding sources. It's an extremely complex matrix if I were to show y'all. But it's a challenge that we take on behalf of the homeless system. So ARPA dollars, we're currently using ARPA dollars to expand services for participants that have federal vouchers. So primarily EHV and housing choice vouchers. We have funding to serve 1,500 individuals and families. We currently have 1,185 enrolled. Our third project is the Homeless Prevention Unit. The Homeless Prevention Unit is a demonstration program partnership between the California Policy Lab, DMH, CO's office, CIO, Hilton Foundation, Brilliant Corners. 157 individuals are currently enrolled. 88% of HPU clients have retained housing. We have currently expanded eligibility to serve families, which is very exciting. And we're looking forward to the final evaluation of this program. It will provide a lot of insight into prevention programs that may expand in LA County in the future. And our final projects are some capital projects we have. We are looking to expand shelter beds on the west side. So we have 171 shelter beds that should be coming online very soon, as well as some additional project-based PSH units. We're looking at bringing on 100 additional PBV units. Now we can open up to any questions that anyone might have.
Great, thank you so much. We've been really excited to hear from the Housing for Health Department for a while. So let's see what questions we might have from our guests at today's meeting. Does anyone want to dig in a little deeper on the Housing for Health initiative and how that meets the needs of the community residents?
I know this has been a topic that keeps coming up on a monthly basis. As you know, this housing crisis is hitting everyone, right? Not just our chronically homeless, but everyday people, you know, are very close or at risk of being homeless. And so it becomes a greater community crisis every day. And so one of the questions I think that, you know, we're really trying to get at is an understanding of how are we doing in terms of hitting the mark, in terms of the larger numbers of, you know, homeless that we know of, and, you know, the way in which we are addressing that crisis through Housing for Health. There's also some community conversation around, you know, cleaning up encampments and the like, but, you know, then the question becomes, where do they go? And how do you prioritize? Why are we able to take care of it in some areas and not in others? For example, Skid Row. So, so those are sort of two pieces. If you could respond to that, that would be wonderful.
Very challenging questions. I don't know, Aubrey, you want to take a stab at them?
Yeah. Well, I mean, I will say we are one part of the homeless services system, but we work really collaboratively with all of the other parts of the system, with DMH, with LAHSA, with any other contributing factors to ensure that that we are continually trying to expand our permanent supportive housing portfolio, as well as access to our interim housing beds and our other programs with street-based engagement and our outreach services, interim housing and recoup. So what's really great about both the two beginning ARPA projects that he spoke about are 1,000 FHSP subsidies, as well as the 1,500 slots that we were able to expand. Is we've been working really closely with both DMH, LAHSA, and other partners to ensure throughput through our interim housing beds, as well as LAHSA's interim housing and street-based engagement and ours, to ensure that we are filling people that are most vulnerable into these slots so that we can continually expand on those programs as well, effectively trying to get more throughput to have more people come in. So yes, we're a part of the system that's much larger than us, but we're trying to expand at any time. And we're very excited that through these ARPA dollars, we were able to expand by 1,500 slots, because that's not a small amount by any means, but we're continually looking at ways where we can continue to expand and help and support more people.
Yeah, we have other, you know, we have, in addition to ARPA, you know, for example, we just expanded our outreach team by 100 staff for the MDT program. So, we have other things in other areas of Housing for Health that might serve folks in encampments. And we're, coordinating with the overall homeless system to better serve folks in encampments. But it's a big homeless system. There's a lot happening. We are just one piece of it.
Hi, this is Monica. I'm just going to go ahead and ask my question. I had my hand up, but I have a couple of questions. One, it's important, I think, for people to understand that when you're talking about matching, it's going through the coordinated entry system. Is that correct? Through LASA?
Yes, for those
And
1,500 slots that we had, those were directly through the coordinated entry system.
And this will go back to the next presentation, but understanding about that housing stock, it's all put in from the different departments, whether it's DHS, LASA, or DMH. The housing stock goes through the coordinated entry system. But my other question is so one of the things that I've been struggling with, and I work for Exodus, so, and before DHS brought in, and the wonderful, wonderful outreach teams that we have now at Exodus and throughout the county, which I'm very grateful for, because prior to that, I was the outreach team and I had 2 AmeriCorps members.
Yeah.
We still need more. Obviously, we need a lot more services, not only the service, and in the beginning, it seemed a lot easier to get people housing and get them connected through the DHS process. But again, it was something that was new, and so it was a lot easier. It's gotten a lot harder because I think there's a lot more people, or a lot of people being more connected. But one of the things, we have this wonderful restorative care village, and I've had one client that were able to successfully put in the restorative care village, but it was really through the hospital that he went through, and it was in LA County. Also, but to get people in that service, I have another client who is at LA County, and my goal is to try to get them connected to when he's ready for step down to the restorative care village. So I understand that a lot of the process is, they have to be in the CHAMP system, which is like, and which can be a little bit of a challenge to get people in that system. So I've been trying to work with the not the medical director, but the medical social worker to do that for this client. But is there another way? And I don't know if he's going to be able to be in the restorative care village. Again, it's about beds and all that stuff. But how, or what is the best way to connect the clients to the DHS system if they're in the hospital or they're on the street and have severe health issues? If you can elaborate on that, or who should we be working with when we bring clients?
Yeah, absolutely. So I will, be the first to say I work on the permanent supportive housing side. And Monica, I remember I was Silver Lake, Echo Park, Westlake, and you're just east of there. So we've worked together. But with that, I think if we connect, we could probably connect offline. I would have to get you in speaking to people that are more with the recuperative care side, just to make sure that I'm giving you the correct information. But that's something that definitely we could take back and make sure that this group knows if there's any other ways other than through the medical social work staff to get into that.
Yeah.
Yeah.
So do you have my email? Can I put it in the chat so you can just reach out?
You can put it in the chat and I'll reach out to you right after this.
Yeah. And I think that for the general population, it's hard to understand the systems.
Yeah.
And for us that we've been working at it, it can be difficult even still. I mean, because I've been part of it for such a long time when coordinated entry started and all that kind of stuff, so I have a better insight. But I think just having someone that can come and talk specifically about the restorative care village and how to work with that population, or to bring them to the restorative care village, that would be amazing. Because I think in our last meeting, that was one of the big questions: how do we get people connected, right?
Perfect.
That was, so once you both connect, maybe we can connect with you, and then circle back with Jorge and our team here at the Med Center to see if we can bring the providers together, you know, to basically talk through how you do it and potentially have a presentation back to HICP.
Okay, this is Carrie. I'll unmute myself as well. Thank you for this report. I was listening, as you mentioned, the need for housing for people who have a higher level of acuity or cannot live in an independent setting like supportive housing. And so we're basically talking about board and care homes, you know, adult residential facilities. And I think we're all aware of the really alarming trend of these facilities closing just at a fast clip. I've found the most recent report I can find from the Board of Supervisors last September is we've lost 1,800 board and care beds in the county since 2016, and 115 facilities have closed because of the real challenges for operators to operate these facilities. And I know Housing for Health will use, and ODR and others will use these facilities for placements that would not be appropriate in PSH. I know the Board of Supervisors authorized a report about a year ago to do a comprehensive study of what it would take to reverse this trend of closing down these beds. I don't know where that is. It seems like it should have been released by now. But are you guys doing any work into helping to stem the closure of these facilities, because they clearly need more funds? They're not in the homeless housing continuum. They're not part of CES, yet they're a very critical part of our housing supply.
Yeah. So our ERC program, we have a separate program called Enriched Residential Care, and they've focused a lot on working with those facilities. I know DMH has some state dollars through CCE that are going to be utilized to assist in stabilizing that portfolio of housing. So I think we are definitely paying attention to that need and trying to focus resources on that.
Yeah, one thing I will just offer is that I have talked to operators who will take the enriched residential care patch, or whatever we would call that additional amount of money, but that is to the detriment of people who are just paying the SSI rate, which is only $40 a day. And so those folks seriously run the risk of being either relocated or ultimately homeless again. So it's kind of a holistic issue. And again, I know that the Board of Supervisors authorized a report on this, I think Brilliant Corners and funded by Cedars. I'm just wondering if maybe the staff knows where that is, because it started about a year ago.
I mean, I can certainly follow up, and if you want to, share your contact information, I can ask specifically about that, and or we can possibly report out on that in a future meeting. I don't have any knowledge of that report.
Okay. I'll put something in the chat on that.
Great.
All right. Well, I thank you so much for this obviously very important conversation that I think has a lot of interest among our participants here today. I think we would always love to stay in touch and continue to hear back on the Housing for Health program. And just, that intersectionality between health and housing is such a critical one in our community, where we have kind of crises across both areas. So thank you so much for the wonderful work that you do and for bringing it forward for us today. Very much appreciate your time.
Thank
you for giving us the opportunity to present to you.
Fantastic. And we're going to continue a conversation about how our community serving organizations are meeting the needs of our most vulnerable community residents. With that, I am delighted to welcome Karen Bernstein, the Director of Care Transitions, to take the podium and share with us about the program and how we serve our reentry population. And I don't know, Felix, if you wanted to do a quick intro before we transition to Karen.
Yeah, here, Monica.
I'll do the intro.
Perfect.
So I think it's important. I mean, it's a continuous conversation. We talk a lot about housing and the housing system, and I know that it can be daunting understanding it. But one of the great things is you have this system called the coordinated entry system where the departments like DHS that we just talked to, DMH, and the Homeless Services Authority, where they come together to capture the people that are experiencing homelessness. And one of the big issues is with this population in general is that they tend to go in and out of jail for whatever reason. It could be a day, it could be, you know, a month, whatever it is. But and that's part of a cycle, right? And so they're part of this. There's this program called the reentry program, right? Or it's a reentry system for that specific population. So Ms. Bernstein is going to talk about this program, and I think it's a great way to provide services for that specific population that is homeless and in and out of the jail system. Take it away.
Thank you, Monica. Let me try to share my screen and see whether I can do it right and see whether I can make it do the little slideshow thing. All right, is that working where people can see the slides?
Yeah, we can see it.
Excellent. Okay. So let's go to the next one. So I'm Karen Bernstein. I'm part of the Department of Health Services, and the part of the Department of Health Services that is called Correctional Health Services are part of DHS. We provide medical care and mental health care for individuals in the LA County jail systems. Have been doing that since about 2016. And it didn't used to be the Department of Health Services that was doing that in the jail. It used to be the Sheriff's Department directly and DMH.
Karen, I want two comments. One, you're a little quiet on volume. If you could increase the volume on your microphone a tiny bit.
I do not know how to do that. I'm using my computer.
If you're on Zoom, you can go to the little microphone icon and click the up arrow and then go to audio settings.
Microphone icon. I see the mute icon. Let's see.
Yeah, that is the same thing. There's a little arrow next to that.
Icon.
And then it says audio settings.
Oh, audio settings. Got it. Thank you. Thank
and
you.
then when that opens, you'll see the second one down is microphone. You can just move the little slider up a little tiny bit.
Okay, is this better?
Much better. Thank you. And then the
Awesome.
second thing I want to say is we do have our meeting being interpreted into Spanish. So if we can keep the pacing, at a rate where our interpreter can keep up, that'd be lovely.
Yeah,
Thanks, Karen.
Okay. I will do my best. I'm sorry. So we have a unit within Correctional Health Services that is called Care Transitions that works on release planning and connections to community services for folks who are coming out of jail. We try to prioritize, we actually have 3 different programs with 3 different funding sources that are under our unit. And we really try to, we only have enough funding and staff that we can serve about 20 to 25% of individuals who are leaving the jails. But we are trying within that to prioritize folks who are experiencing health or mental health issues, substance use disorders, and or experiencing homelessness. There we go. Here's the little kind of map of our unit. We have a program that that works just exclusively with our high acuity mental health population in the jail. We have our whole person care reentry program, which has continued even after whole person care is officially ended in the county and is transitioning to something else. But that program works more with folks with medical conditions and substance use disorders. And then we also have a homeless initiative funded program, which is in reach from 4 different community-based organizations that come in to the jails and work with folks and then continue working with them after they are out in the community. Just a second on why reentry care coordination makes sense. There's a very high proportion of individuals in jail that are experiencing the issues I just mentioned. Study after study has shown that there are real health risks to being leaving incarceration, right? So there's an increased risk of death in the initial weeks after people are released from incarceration. There are huge racial disparities for the folks who are in jail compared to those who are, that sort of the same groupings in the community. So it's really a equity issue to sort of be doing this work. And there's a lot that's needed. People have their benefits suspended sometimes. They're given a time-limited supply of medication on the way out. And so people really do need help to sort of navigate those systems to reestablish that. And then just layered on top of all of that, just sort of the justice-involved population really experiences just a bunch of barriers to care, right? There's stigma, sort of having lack of trust in systems of care, difficulty navigating multiple systems. So all of that sort of layered on. Just a really quick snapshot of who's in jail as of yesterday. The LA County jail system is huge. It's about 13,000 plus folks. This is actually lower than it has been recently. So it's been in the 14 and 15,000 for a while. The lowest it got was down in the 12,000s during the pandemic, and it's crept back up. We're trying to, the community is trying to close Men's Central Jail, right? So we're trying to get this number way, way down into the 8,000s so that can happen. 11%-ish are female. And then here's the racial disparities, right? 29.4% Black compared to 8.1% in general in LA County. 53.9% Hispanic compared to 48.6%. That's not as out of whack, but still higher. And then the mental health population is very large. So over 5,500 individuals in jail who have mental illness and are receiving medication or being treated in the mental health programs in jail. Which just keeps rising. Actually, that if you look at the curve of it, it just keeps going up. It's up 21% just since 2020. So we're sort of concentrating more on the mental health population. And then 26% self-identify. There's a question asked at jail intake: are you homeless? Yes or no? Asked by the Sheriff's Department, and the 26% of people say yes. And also, I just want to note the website that's down here at the bottom, the Vera Institute. Has really good, they have a website that's actually focused on sort of decarcerating, LA County and the efforts to close Men's Central Jail. And they're pulling information from the Sheriff's Department, presenting it in a really nice graphical way on the data. So if you're interested in looking at a little deeper dive in the jail population, please hit that website. Just sort of a little overview of what we do. We do release planning, and we start with a needs assessment and strengths assessment of folks in these different domains that are listed on here, sort of the different parts of everybody's life. We also do level of care assessments for folks with mental illness who are returning to the community. So we kind of get a sense of what's the right level of treatment that they need when they return. We review records from prior jail and mental health services, and then we try to work on an initial plan for linkages. I'm just going to go through kind of the different types of linkages that we can do and what we try to do. I know that there's a real focus on housing from this group. Housing is one of the biggest things we try to work on. We do work with our DHS Housing for Health colleagues, the unit that just was speaking. Really, we cannot from jail get people directly into permanent supportive housing. It's just not feasible to do that. We need to get them into interim housing first. And the type of interim housing that Housing for Health has is one of the main resources that we use. We can get folks into recuperative care if that is needed. We can get folks who have SSI into board and cares also through Housing for Health, but we cannot, their ability to get folks into board and care who don't have SSI requires sort of the referring source to have kind of bought those resources. We don't have the ability to do that from the jail. But some folks with SSI can get in. We also make referrals through the LA Homeless Services Authority, LAHSA, for their interim housing that they contract. Both of those are through the Measure H, what used to be called B7, which are there's a funding pot for interim housing for people exiting institutions which include hospitals and jails. And so the B7 funding is funding that's that LAHSA and Housing for Health use, and that we are accessing those beds through that mechanism. We also have folks who are on AB 109 probation. It's probably too much to get into what that is if you don't know what that is, but anyway, there's a probation, folks who are on that type of probation. We can coordinate with probation with Health Right 360 at CBO that has the contracts for their interim housing that they can get into that's funded for them. And then we do also, we actually do quite a bit of kind of helping people to return to family or friends or home or you know, somewhere where they have a residence with someone they know that where they can. There are also, you know, several of the mental health treatment linkages are residential types of treatment, depending on what level of care folks need. So we work through the Department of Mental Health. They have actually 3 separate different kinds of gatekeeper processes, depending on the levels of care that we need to get people into. And we are referring sort of based on their acuities. And some of these are quite a process to get people in. So it's several months in order to get folks into these types of facilities, particularly IMDs, which is Institute for Mental Disease, which are locked facilities. You have to be conserved. Enriched residential services are also you know, residential mental health care for folks with pretty high acuity mental illness. Those are voluntary. It's a 3 to 6 month stay. They are also hard to get into, but we do successfully get people into these. There's a set of co-occurring disorder treatment sites where they can treat both mental health and substance use at the same facility. We work on getting folks into those. And then in addition to the residential settings, we are trying to link to full service partnership programs where folks are out in the community, but have some pretty intensive wraparound mental health services. And, you know, we are also just connecting to making people their mental health outpatient clinic appointments, you know, before they leave jail to make sure they get connected. We also do substance use treatment linkages, which are often residential from what we're doing from the jail. So we have a collaboration with the Department of Public Health Substance Abuse Prevention and Control program. We've actually created kind of like a collaborative of 14 different providers in the community that have multiple levels of treatment and that are willing to take folks directly from jail. We didn't used to be able to send people directly door to door, but that's absolutely key when you're trying to connect folks to treatment services, because once they end up back on the street, it's really hard to sort of then pivot and go back into treatment. So we have a shared process and a shared screening tool that we use, and we have some substance abuse counselors who do the screening that we need and are trying to link them to providers. Just wanted to note the challenges. We are not always successful. We are probably not most of the time successful, right? So we do a lot of you know, of trying to overcome all the challenges we have. One of the biggest ones is there are unpredictable release dates. So from people coming from prison where they've been sentenced to a certain amount of time, and they know their release date, and sometimes that moves up, but there's generally a good amount of notice for that. Jail is very different. People are often in jail for a short time. Most people in jail have not been sentenced yet. They're going through their court process. Some people are unsentenced. Some people are partially sentenced and going through a court process for another charge. And so we don't know what day they're leaving. Anytime they go to court, they may be released with time served. They may release on bond. They may you know, be sentenced to I think I already said that, basically sentenced to time served, or their case may get dismissed, right? So we are trying, it's very, very hard to connect people to services when you don't know when they're going to the service, because the agencies who need to accept them need to know whether they have a bed that day or they don't have a bed that day, sort of thing. So it's really hard to do that. There are, of course, scarce resources in the community for housing and treatment, as everyone is aware. A lot of efforts going on to try to increase that, but you know, we're very connected. Our success is connected to sort of the level of those resources in the community. As I said, many of the referrals for these resources can take several months, and people are not necessarily with us that long. Also, just access to clients in the jail environment. We're going out and talking with clients in the jail all the time, and there are lockdowns, and there's no privacy in many cases to talk privately with folks about what their needs are. So it's sort of a difficult environment in trying to help people in that kind of environment. And then we do get a lot of declining, right? So folks saying, no, I'm good, I don't need your services. And we will go back and try again, and we do motivational interviewing and all those things. But we definitely, we also get folks who we do a lot of work to connect, and we have set up to go somewhere, and then at the at the jail door, they're like, oh, actually I changed my mind. And so then they'll, I'm just gonna go see somebody or whatever. We do have some point of release services where we've set up a desk in the release area of the jail from our whole person care program, where we kind of try to catch people who are unexpectedly releasing that we've been working with, to make sure that we can try to make linkages at that point, if possible, notify a community health worker they've been working with in the community, or they're going to work with in the community, notify DPSS to turn on their Medi-Cal, and things like that. I think I skipped a slide about Medi-Cal and health benefits, so I'm not sure how that happened, but we also help with that stuff. We do try to get folks on Medi-Cal and get it unsuspended after release, and connect them to medical care also. I'm not sure what happened to that slide. We do give folks a written continuing care plan if we've been working with them on that plan. And we have resources including hygiene kits. There's a vending machine with free Narcan, thanks to our friends at what used to be ODR, is now the harm reduction unit in DHS. We give them resource information. We also are very lucky to have 3 drivers and 3 vehicles, at which we're able to provide coverage Monday through Saturday. So we transport people to programs or interim housing, or back to family or whatever upon release. We also have tap cards that we give out to clients, $15 and $25 share stored value cards that we give out. We do connect folks. We try to connect folks to community health workers in the community, which was set up sort of through our whole person care reentry program. There's a set of community health workers who are contracted by, I shouldn't say Office of Diversion and Reentry anymore. I should say JCOD, through the Justice Care and Opportunities Division Department. So that is now with JCOD. And we also have some, these are our community health workers who have lived experience of prior incarceration. We also have some additional CHWs that are embedded with us in the jail and work with folks in the jail, and then keep working with them in the community. And then our Homeless Initiative D2 program does have the case managers from the 4 CBOs that are contracted. They work with clients both in the jail and in the community. And just putting up some contact information. My contact info is here. If people know folks in jail that they're, or if you work for a CBO and you have a client in jail, and you want to make sure that you're concerned about them, you want to make sure that they have are getting some release planning, you can refer to us, and we'll do our best to see whether we're already serving them or if there's something we can help them with. And then I always like to just note this phone number, the Jail Medical Command Center, for people in the community. If you know someone in jail and you're worried about them because they have diabetes, or they don't have their glasses, or they, whatever it is, if you need to relay information or about a healthcare concern to the jail medical teams, there's a phone number for that, and it's on this slide. I'm happy to answer questions. I'm sorry for talking faster than I was supposed to.
You had a lot to cover, Karen. We appreciate that.
Exceed my time.
And thank you for being so passionate about the work you do. Clearly, it's so critically important. And, I just think everything you shared with us kind of echoes and underscores things that we knew were true, which is this is a population with high needs, high vulnerabilities, and, just need a lot of care and consideration. Do we have any questions or comments for Karen?
I have a clarification, and I think it would help people understand. For this type of service, people don't have to be in jail as long as they've had as long as they've had come out of jail recently or have been in jail. Is that correct?
Right. So the post-release part of the work, which is actually through, so JCOD has these contracts for reentry intensive case management services, which are and Exodus, I think that's one of those contracts, is one of our D2 agencies actually. But there are, there are CBOs that have, I think it's about 25 CBOs that have those contracts and have community health workers. They can take folks, who are not directly coming from jail. They can take folks who are out in the community and have had recent justice involvement. So both pathways.
Thank you for that clarification. Any additional questions, follow-on questions for Karen?
Just a real quick one, I hope, and we can follow up if you want, but is there, this is a very comprehensive and very, a great program with interventions like we haven't seen. But I was just wondering, do you have a sort of incorporated way to evaluate and, sort of an accountability frame to all of this? I didn't see that. I might have missed it because I had to step away for a second, but
yeah, there've been a few attempts at evaluating. So the whole person care program kind of struck. This was one of, I think, 16 total whole person care programs in the county. And there was an evaluation around that. And it's so hard because everybody wants to know the recidivism outcomes, and those are difficult to track across the different types of data in the county. We did show, some healthcare outcomes out of whole person care, some a modest increase in kind of the appropriate use of people getting connected to primary care, people, using less emergency room services. We're attempting to track numbers of sort of where we link people to, but it's hard because we don't know whether they stay, right? So we can link, but they may turn around and leave. And so we have a difficult time tracking true outcomes. And there have been some efforts in the county. There was this thing called the Justice Metrics Framework, where the county CEO, from the county CEO's office, where they were trying to kind of pull all these streams of data together from justice systems and healthcare systems and try to, start looking at this stuff. And I think that has not gotten as far in terms of like being able to issue a report on these types of outcomes as we would like it to. But there are some efforts to try to do those types of evaluations.
Well, I feel your pain. I say in the spirit of that, we're in this catch-22 where the funders, whether public or private or corporate, are always wanting the evidence and etc. And yet the problem to STEM is so immense. But very well done. Thank you.
Thank you again, Karen. Really appreciating the thoughtfulness of the work that you do and the presentation you shared with us today. Just very, very grateful for your time to give us an update on what's happening and how, the needs of our reentry population and how we're trying best to meet them. So thank you so much for that. With that, we will say once again, thank you to Karen. Thank you to all of our incredible speakers today. We have one final presentation. I know we're running a little short on time, but I'm delighted to ask my colleague Rosa to walk us through on lightning speed an update on some of the campus project work. Thanks, Rosa.
Yeah, I don't think we have, none of this is urgent pressing. Let's go to the next slide. So just wanting to let everyone know that the RFP process for General Hospital is underway. We are to receive proposals today on June 2nd. So by next month, we should have a sense of how many applicants and, maybe what the status of the process is there. So nothing, nothing more than the big day is today. And just wanting to, let you know that we're still in the process of identifying our team for the community community evaluation council, and we'll be working with our team at AECOM to identify those individuals who are going to be invited to this advisory capacity. And so the seating of these groups will be done in June, and the work will begin in June. So upon invitation, the individuals have to commit to the dates that are given as the advisory group dates, and must comply with the dates for meetings. The next slide. So we also are in the process of scheduling our community meetings with Supervisor Solis, HICP, and Eastside leads. And so the vision for this is to have an opportunity to go back to in-person, to go back into the community, and request that that we have a conversation at a community level in person. Discuss some of the advancements at Los Angeles General Medical Center, discuss the change in our name, also discuss the opportunities that are now available in the Restorative Care Village, and discuss the General Hospital West Campus RFP process, which we're in the middle of right now. I did see Juana's comment about whether you can participate. Juana, muchas gracias por su pregunta. So the challenge of the technical group is that these RFPs are potentially coming in at a very high volume of documentation. So it's going to be very, very difficult for us to be able to translate every document into Spanish or any other language. So it will have to be, you will have to be fluent in English for this technical piece. And that we do every effort to make every process accessible. But in this particular case, the recommendation by County Council is that we engage those advisory group discussions in English. So we will discuss with each of you those requirements as you're nominating yourself for the process. So thank you so much for your interest in this process. So Heather, I think that is all, except to say that our kids are here on State Street, right at the Child Care Center. You all know we did the ribbon cutting a few weeks ago. I think it was like a month and a half ago. They were still waiting for their license. I think what they shared with us is that the moment they got the license, the immediate next business day, they were able to move the kids over to the Child Care Center. They did. So our wonderful Child Care Center is now open on State Street. So is State Street. It's one way, starts on Zonal, goes to Marengo. And so just be very careful if you do go by and want to see, just remember there's little ones, in that general space, but we're very excited. And so congratulations to our Child Care Center that opened up. Okay. And that is all. There's a mural there. You can also walk by and see, and these are some of our little ones, that came to the unveiling of the grand opening. And we look forward to having them continue to enjoy, some nature and some wellness and some new space for learning at the Child Care Center. So congratulations to them. That's all I have, Heather. So let's go ahead and.
All right. Well, thank you so much, Rosa. Thank you one and all for your contributions to today's meetings. I do see a hand raised from Teresa. We'll take a comment from you, Teresa, before we close it out today.
Hi, everyone. Teresa Velasco, LA General employee, also labor. Just wanted to confirm, other than the email nomination, there's no actual form in regards to the committee?
No, you've done, you've participated to the degree there is participation. Thank you so much, Teresa, for following up.
Just want to confirm. Thank you so very much, everyone. Have a great day.
Yep. Thank you one and all. Have a wonderful rest of your day, a wonderful weekend, a wonderful start to Pride Month. Hopefully you'll find some great events to participate in. And of course, we look forward to seeing you back here again in 1 month's time, the first Friday in July, which will be Friday, July 7th. So between now and then, of course, we've got holidays, we've got celebrations, including Pride and Juneteenth on the campus. We invite you to come out and join us for some of those wonderful activities and events. And please stay tuned for more updates about the General Hospital West Campus process. We're excited to see how many proposals are submitted by today's deadline so that we can continue the next steps in the process, including our evaluation process and our community meetings. So with that, everyone have a wonderful, wonderful weekend. Thank you so much.
Goodbye.